health. Today, we're going to go through a whole concept, a concept of something that I feel has been hugely lacking in rehab, performance enhancement, prehab, spinal hygiene. This is an overall complete look at the core. Now, the core is one of these sort of elusive terms that has a bunch of different meanings. We're going to define it as we go, and just by the nature of the 10 levels that we're going to go through, we're going to understand the complexity of the core. Sometimes the core is broken down, or the lumbar spine area, a little too incompletely. Stu McGill is great, lumbar spine biomechanist extraordinaire, but having just the big three, he's got other exercises, but I see a lot of clinicians focus on 3 exercises as opposed to the breadth and width of what's important through the entire core, so we can use it in as a complete unit and find any gaps in the core that are leading to performance issues, pain issues, dysfunction issues, compensation issues. So we're going to once again think of the core as a 10-level building. We're going to start at the ground floor. We're going to start with the most primary of movements that we need from the core for both mobility, stability, control, power, endurance. We're going to go through them all. We want to take a look at how we can completely assess the core first. Each level is going to have a 1 or 2 core assessments to see how we are doing at that level. And then each level is going to have a very specific focus then of different motions to step through to get to the next level. The first part of understanding the core is understanding these 10 levels or 10 areas of the core. So let's go through them just briefly and talking about the emphasis and what we're going to mostly be looking for, why this area is important, and then we're going to take through self-assessment and then the corrections ultimately. So this is sort of the path we're about to walk our way down. So let's start with number 1 level, the base floor level. This is pelvic tilting, gluteal control, gluteal activation. This is the base of the tower that is your axial spine. The base, very important, most important area of most towers. So we're going to take a look at how do we activate this area? How do we move this area? How do we move in this area to modulate low back position, hip position, knee position? The glutes are the largest muscle in the body. We want to make sure we can activate them properly. Do we have enough hip extension to go into a posterior pelvic tilt? We're going to go through some self-tests one at a time to see how that area is functioning and if we need to address it. So that's the first level. The second